I'm so excited to be talking to Alison Cini today, who is an MS specialist nurse in an acute care hospital at Royal Berkshire Hospital in Reading. She sees patients face to face. She talks to patients on the phone. And as an MS nurse, her role is really broad. She is involved in identifying MS and getting it in the diagnosis. She is involved as an MS nurse in counseling patients, helping them get started with DMTs, managing symptoms. And basically, I think our nurses are tasked with this huge job of being problem solvers, right? And thinking outside the box and figuring out what does each person need. So as part of your job, I think you're also always connecting patients to reputable information because there's so much out there on the internet. So what's really impressive about what you've done is that you're just one person. You had an experience and then you decided you needed to share it with other people. So tell me, what made you want to bring mindfulness into the care of your MS patients?
Okay, so hi everybody. I think what it was obviously COVID was a very anxious, provoking time, and I decided to do mindfulness myself. It was something that was brought to the NHS nurses and suggested would help us get through a difficult time. So I started practicing it myself, and I found it really balanced my emotions, and it really helped me get through what was quite a tough time for everybody, especially nurses and doctors in the NHS. So I had a little think about it, and I thought, how could I bring this to my MS patients? Because over 50% of MS patients have anxiety and depression.
Yeah.
And I thought, this could be a really good therapy for patients to help them. There's been research to say that mindfulness is as effective as antidepressants. And there was a gap in our clinics. I felt that we were treating the physical symptoms, but not the emotional symptoms, really. We might quickly, say, oh, you can go to a counsellor, and you probably don't know it that well in England, but we don't really have specialist counsellors, although we do have one lovely specialist counsellor at the MS Centre, which I started to refer to. But other than that, there wasn't very much for MS patients in particular.
Yeah.
So that's where I came to it. Yeah.
This is why it's so important that we as healthcare professionals who take care of MS patients also look into these therapies, because once you saw that it helped you, didn't it change your practice?
Exactly.
Yeah.
It really changed my practice, because actually then I started reading books and things about how even mindfulness, doing mindfulness as a healthcare professional can make you a better healthcare professional at then being compassionate towards your patients. And but I was really interested in how it could help my patients, because a lot of people would come into me with MS and they didn't even know that they were anxious or depressed. And a lot of the research I've done shows that often anxiety can be missed in a routine GP appointment, because I think because MS patients often go in with lots of different symptoms, and then that's not always picked up on. And if it is, then we can get the right treatment and we can get the patients feeling a lot better.
For sure. I mean, that's how we start
Yeah.
improving quality of life. And I
Yeah.
think what you said is really important, that oftentimes people don't even realize that they're anxious
Yeah.
because it's been their baseline for so long. And it's just kind of like the human experience of modern life, right?
Yeah.
And so it's hard to actually identify that anxiety is there all the time. And it's important that we actually look for it as healthcare professionals. So for anybody out there listening, if this sounds important to you, talk to your doctors and nurses about bringing this into the care that you're receiving. So tell me a little bit about the clinic you've set up.
Okay, so we have something called an MS therapy center, which is like somewhere, it's not hospital run, it's a charity run place, and they run things like oxygen therapy there, or acupuncture, reflexology, but I'm running my mindfulness clinic alongside the MS counsellor there as well. And so I do 4-week courses. I trained with Mindfulness Now, and I do basically every Friday for 4 weeks for 50 minutes with one patient at a time, because I feel that works better initially, one-to-one. And I'm just in the process of setting up a group so that the people that have gone through the 4-week course can go to the group sessions after that, so they can continue their practice and they have support with like-minded people.
So you initially start
Yeah.
one-on-one, because it can be a little
Yeah.
bit daunting to be thrown into a group
Yes.
when it's all new to you. So that's such a lovely
Yeah.
approach, actually, and just shows so much care and compassion on your part. And then once they've gotten acclimated, then you put them into groups. And now, and I think what you said was like-minded people. When we are surrounded by people who think like us and have the same goals like us, it makes it so much easier to keep
Yeah.
up meditation practice, doesn't it? So what benefits have you seen from the work that you've done? Like, what have patients told you as feedback?
Yeah. So I give out a feedback form to them at the end of the course, and there's been noticeable improvements in reduction of anxiety over the 4 weeks, depression, and also pain reduction. One particular lady went from a pain rating scale of 10 to 3. So 10 being really in pain, obviously, and 3 being less pain. And I mean, I thought that was quite remarkable. Although I'd only sort of read the research about the pain side of things, I actually saw it working, and that sort of made me realize it does really work, even more than I thought, because I'd only really seen it initially with anxiety and depression. But yeah, so that was interesting.
That's huge, to go from a 10 to a 3 for pain. And,
Yeah.
most of our pain medications have side effects. And I'm not saying we
Mhm.
shouldn't use pain medication,
Mm.
but if you can combine mindfulness and meditation with your
Yes.
medication regimen, I bet you'd use less meds, and that
Yeah.
would have less constipation and less other, problems that go along with the meds. So I think
Mhm.
you are onto something really big, and I love that you're just building it and really being very careful and thoughtful about how you do it. So I was hoping you would share with us your presentation to teach us about mindfulness and meditation and what it has to offer us. So if you want to go ahead and start to do.
Yes, sure. Yeah, I'll share the screen. Mindfulness. What is mindfulness? Is your mind full, or are you being mindful? Are you like the man walking along thinking about what he's got to do next? His car's needs to be fixed, all his worries, that he needs to do things. Or are you like the dog who's thinking about what they're doing, going on a lovely walk, looking at the trees and taking it all in? And I think a lot of us are like the man, and we'd like to be more like the dog. So the idea is just to be in the moment. So mindfulness is a technique you can learn which involves noticing what's happening in the present moment without judgment. And another quote by John Kabat-Zinn, paying attention in a particular way on purpose in the present moment and non-judgmentally. And then my favorite one is, you only have moments to live, this moment, then this one, then this one. So a good way to describe mindfulness is the window of tolerance. So we can describe it as you as a sailing ship, sailing along nicely in your window of tolerance, and suddenly you get knocked off course, you get anxious, overwhelmed, have racing thoughts. And that's where mindfulness comes in, and we can bring you back down into your window of tolerance. And alternatively, you can go under, you can get numb and sluggish and shut down and withdrawn. And practicing mindfulness will then bring you back into your window of tolerance. So there's two types of mindfulness. There's formal and informal. So the formal is the guided meditations that I do, or you can go on mindfulness apps. Or there's informal, which is something you can do yourself, where you do like mindful eating, having a mindful cup of coffee, having a mindful shower. So just to summarize, mindfulness is living in the now, not feeling guilty about the past or anxious about the future, just taking yourself out of autopilot. So what mindfulness helps with? It can help with stress reduction, clarity and focus, builds resilience, improves relationships, improves concentration, gives you greater confidence and self-esteem, reduces anxiety and depression, which we've said already, can improve your memory and also reduce pain. So there's 9 attitudes of mindfulness: non-judging of yourself and others, patience, a beginner's mind, non-striving, which is one that is quite difficult for most people in modern society to use, because we're all striving towards goals and exams, but mindfulness is about not doing that. And acceptance, accepting where we are, not necessarily being happy about where we are, but accepting where we are and what we're doing at this moment. Letting go, generosity towards others and yourself, gratitude, and often people do gratitude diaries, just feeling grateful for what you have in your life, and trust is another one of the attitudes. So developing regular mindfulness can really build your resilience against stress, which is something that we all need in this world at the moment. So science validates MS and mindfulness. People with MS are twice as likely to suffer with depression, and this can create a cycle of depression, then inflammation, increase of your physical illness and increasing depression. Mindfulness is effective at treating depression and is approved by the NICE guidelines, and these are guidelines that we use in the UK. So neurogenesis is a word. People with MS are more prone to neurodegeneration of the brain. So research has shown on MRIs that regular mindfulness can increase the grey and white matter of the brain in specific and important areas, so thus promoting neuroplasticity and creation of neural networks. It reduces physical pain, so therefore patients are less judgmental of their physical sensations. It can increase happiness, and after 1 month of regular practice, it's proven to help your emotions. So why is it important for our patients? We want to treat the patient holistically now. So looking at mind and body connection. So looking at our emotional health, not just our physical health. And I found in our clinics, often the emotional health was often forgotten, or was just sort of at the end of the clinic. Oh, were you okay? You know, but it wasn't the focus of the clinic appointment. It was the symptoms, the physical symptoms. So, and also stress is one of the main triggers for MS relapses. So why aren't we, you know, dealing with stress and finding therapies to reduce our stress, to therefore help reduce our possible relapses? So therefore, this was just a case study I did when I was doing actually an essay. So I won't really go through that with you, but it was quite helpful. So I changed the MS service, offering mindfulness clinics, which I've already said, at the MS Centre, introducing patients to the concept of mindfulness in our newly diagnosed sessions, which we run twice a year, as I felt that it was good for new patients to have the knowledge as soon as they're diagnosed and be able to help themselves, and signposting patients to websites, apps and books where they can find help. This was the course that I studied with Mindfulness Now, which is a mixture of mindfulness-based stress reduction and mindfulness-based cognitive therapy. And I just got a reading list here of a few books that were quite interesting to read if you fancied having a look and a read of any of these, and some of the apps and links that are quite useful.
Thank you for sharing those important words with us. You know, thinking back to what you said about non-striving, I had actually not really ever thought about that, and how it might feel so unnatural to just be, right?
Yeah.
I'm going to take that away from your presentation. And I thought, well, maybe I could start living that way today, right?
Yeah.
More flowy, more fluid, right? Rather than I got to do these 10 things in the next hour.
Yeah.
Okay. And so this is so important. Some of the data that you've presented, and there's so much data out in the literature, that this is an approach that works, and it actually must be a part of MS care. So for anybody listening out there, if this clicks with you, talk to your nurses and your doctors and ask for it. And maybe we can get other nurses trained, right, Alison? They maybe trying to reach more people, because if you can cut down your pain score by 7 points, there's something here. These are tools we are not using. And this is what I'm always talking to my patients about. We got to use all of our tools. This is the biggest gap in MS care. And thank you for willing to put yourself out there to learn something new, to do something uncomfortable. I'm sure this wasn't easy to start doing. Because we know stress triggers MS diagnoses and relapses and progression. So let's do less of that, right? And neurogenesis, like we can build new connections in the brain, right? We just have to do that if we want to live well into our older years. So this is a tool that doesn't cost anything, that's always available to us, and it works. So thank you for bringing attention to it. It's so important.
Thank you.
And so how can people reach you if they want to learn more or figure out, maybe there are other nurses and doctors out there who want to learn from you? How can we connect you with them?
Probably LinkedIn is the easiest way at the moment, because that covers the whole world, doesn't it? So that's probably the easiest way.
Right. And you're very available, and also some of the resources you shared in the notes, so that people, if they're not in your local area, that they can still have resources to get started on this.
Yes, yeah, the books and the apps and things are a really good start. I mean, initially I used the Calm app. I don't know if you've heard of that Calm app.
Yes.
Yeah. So yeah, I found that that's quite good as well if you want to just get started. But I think a course is really where you find out more.
Yes. So yeah, lots of wonderful apps out there to get you started, but really tapping into other people who are like-minded, I think will get you really
Mhm.
far. Yeah.
Yeah.
Thank you for being the amazing person that you are and for doing this good work. And I hope that we can keep building on this.
Yes. Thank you for having me.
It was a pleasure.